psychology automatically will be corrected. Automatically will be corrected. Okay. If patient is psychologically pure, you should be what do you complain? Pain. Because pain is an information. Pain is not a disease. Pain is just an information. From where it is coming, I have to pick up. Anyhow, I have to pick up. If I tell psychological, better to tell, I can't do anything, please. You can go to the other route. But you are not a psychological. Then sometimes person will challenge you. How you can say I'm psychological? I'm very intelligent. I'm working a very high level job. Why I'm spending money to come to you? Am I just spending time here with you? No, I have come here, I have pain. If you are not diagnosing, it is your problem, it's not my problem. You are not that much knowledgeable to diagnose this. So you can think like this way so that we can focus on anatomy, neuroanatomy, ANS to search the pain generators and to give a diagnostic block. That is our target, how to give a diagnostic block. Because pain cannot be written. Radiologists cannot write the symptoms on the reports. So I will never see the reports. I will totally try to assess the film with the symptom. Film with the symptom. You do your MRI, you must be having some problem in your spine. But you don't have symptoms. You say, if you don't have symptoms, I am normal with so much abnormalities. That is the beauty of the embryology. Okay, that is the beauty of the embryology. We are normals, but we are normal with a threshold of that embryological defects. So that's why your regular knowledge of anatomy, revise every day, all these things. And you're increasing the skill. Same procedure repeatedly, so that by your finger gets maximum experience with feel, like your cervical epidural. One of the, I used to say, is the toughest and most complicated procedure out of all the procedures. Why toughest? Maybe it's very easy. Many people are giving left and right because your confidence, you are working in millimeters, 1 or 2 millimeters, you have to keep the needle tip. No other procedure is such a complicated, such a dangerous. If you can do it regularly, left and right, you can do any procedure. You can do any procedure if you are so confident in cervical epidural. Okay, because your danger zone is very, very small. Okay, no other procedures completed like this. And your thorough knowledge on CM. CM, just you have to teach your technicians always. You know each and every angulation, how one picture, analyze the CM, take 2 minutes time more, you will use 10 shoots if you analyze 2 minutes more. So in that way, we have to work for years. Patient is coming for 1 day, otherwise I will develop cancer after some day. Many people, they have suffered with this. So that's why CM many people, they are not learning, they are avoiding, they are going more on ultrasound. No, ultrasound has its advantage, disadvantage. CM has its advantage, disadvantage. I have to master both. We have to choose the best this armamentarium for that procedure, so that I can do it with minimal time, with maximum perfectness, so that patient will get more benefit and you can reduce your time. So complication can be divided into 3 categories, whether it is pharmacological related complication, procedure related complications, and implant or equipment related complications. So pharmacology, we know these are the, particularly when intervention is coming, these are the most important pharmacological agents which we are using: local anesthetics, steroids, platelet-rich plasma, opiates, neurolytic agents, hypertonic saline. Most of the interventions we are using these pharmacological agents only. If we think local anesthetics, most of the people are doing all these things. I'm not going to much detail. So that's why for your injection, always inject dye in continuous fluoroscopy. You can save maximum exposure, so that give maximum exposure during injecting dye. So no question, every second I can see where it is going. Okay, so that will help you to reduce maximum complications from this pharmacological agent when you are injecting. Your dye has to be so perfect. Many times, even I have seen lumbar sympathetic block, I am given very good drug spread was there. Once I have injected the medicine, patient came to immediately got complications. Microvessels, we can't see every vessel there, but we have to try as far as possible. Dye injection has to be always under continuous fluoroscopy. Don't dilute the drug. the wrong way, because I want to see something. Why I will dilute? If I dilute, picture will be less clear. So don't dilute. Rather use less dye. Use less dye, but no dilution. It is always better. Because, but giving more dye is the wrong method. Always try to see for every procedure how much dye has to be given is not same for every procedure. So like simple example, you are given a transfemoral epidural. Transfemoral epidural means you are entering into the anteropetal space. When you are entering into the anteropetal space means you are medial to the psoas. Your psoas is totally packing the lateral wall of the foramen. So once your needle is anteropetal space, dye should go more medially than laterally. If the dye is coming more laterally than medially, still you are inside the psoas. Still your needle is inside the psoas. I think everybody understood the anatomy, because you are into the lumbar plexus. You are not at the root. Little difference. So after putting the needle, just inject half ml and see dye is going medially or laterally. Immediately you will come to know you are inside the space, because once the dye is going medially, then and hugging the medial surface of the pedicle, then you are perfectly doing transfemoral epidural. Otherwise it will be no root block. So this has difference. They both will work. Why they will work? Because it is a pseudo-unipolar neuron. Whether you are giving the drug on this hand or this hand, it will work. But your cause is disc. Unless I am putting the drug in front of the disc, how will reduce the irritation? Okay, so that's why not only you are working on the symptoms, working on the cause also. So these are small things, very important. Like your steroids, always we try to use non-particular maximally. But triamcinolone nowadays, many people we are using, even in cervical epidural also. That's why your dye spread is so important. The epidural, which is the most important feature you will get in the dye spread, it is the epidural fat. Unless you see the epidural fat, don't inject. Because epidural fats are only seen in epidural only, not in subdural, not in intrathecal. Okay, so once you are injecting the dye, and don't practice giving epidurals only with needle. Always put catheter, always put catheter. Needle is sharp, you will not mind. Once you are putting once you get the space, immediately put the catheter. Don't leave the hand. In the left hand, you are holding the needle, you are using the loss of resistance syringe. Once you get the loss of resistance, immediately keep everything ready with the introducer, immediately put the catheter. This catheter is blunt. And what we are practicing, coming from one level, so the catheter can smoothly go up. And what is your target, where drug is reaching or not. If your target is C3, 4 and you are giving at C71, just for sake of giving, you have injected, you thought it will go there, it may not go. Your total effort is gone. Okay, it will go up as well as it will go down also. So some drug has gone down, all these things will waste. So that's why always make a practice, and no hurry. Don't do hurry. Because you are doing a procedure, you take more time, you can ask more money from the patient, or whatever you are asking for the patient will realize doctor has taken this much time to do the procedure. Okay, this is not a very simple thing, has gone and given an injection. Why you are charging for this? Because you are taking risk. So don't do hurry. Put the catheter, see where the dye is going. Many times you will get the blood coming out. So don't get scared. Epidural space, they are all venous blood, not arterial blood. Arterial blood is there in the foramen. If you are doing transforaminal, then arterial blood will come. But if you are in the epidural, 99% of it is venous blood. Nothing will happen. No need to discard the case. You just change the catheter, you just take out the catheter, change the needle direction, or change the another space, you can finish the procedure. Even if it is subdural, you no need to discard. Okay, so if it is intrathecal, then only you can discard you should discard the procedure. Otherwise, there is no need. So now coming to so better to use triamcinolone, but if you are thinking anytime any kind of complication is coming, better not to use local anesthetics, only dexamethasone. I don't want to tell, so many incidences are there where I am scared to inject local anesthetics. Because when I am injecting dye, patients are getting some problems. Doctor, I am getting this problem, that problem. Better, but you are in the space. So that time, better use only steroids, not triamcinolone, only dexamethasone. Because you have reached the state and then you cannot come out. Okay. Okay, now platelet rich, most of the time the pain is the most of the thing, but infection also can happen if you are not following proper aseptic precautions. Morphine, fentanyl, you all know nausea, vomiting, because morphine, if you are giving particularly IV or intrathecal or epidural, these complications are there, you can avoid these things. Now I will come to neurolytic agents. Neurolytic agents, glycerol I have never used, but phenols and alcohol, left and right we have used. Phenol is a kind of long-acting local anesthetic. Okay, so if you are thinking you don't know, it's not a cancer patient, so you can use phenol. Okay, say like ganglion impart, you are doing it. You are doing RF, on top of you inject phenol, or you can inject alcohol with a lower percentage, say 20%. You have always 90%, but why to use in a non-cancer patient 50%? So better to use 20%, 30%, 10%, it will be better than phenol in that way. Okay, so but better to always combine with a RF and neurolytic agent to get better, because we can't see those nerves, whether you are particular in that anatomy, the nerve is not there, you are burning the tissue, you thought it is RF is done. So better to do always combined with, and whenever you are buying alcohol, buy 50 ml from patient, keep it with you, don't give the patients, but this will help you in the emergency situation. When in the middle of the night, I got a patient like this, cancer patient, in the middle of the night, he wanted immediately do is, from where you get alcohol? Then, so this will be your stock. So don't return all these medicines. 100% or 90% better not to use. Better not to use. Don't try to get a very good effect or a lifetime effect. No, there is nothing lifetime. Patient will ask you, doctor, is this permanent? Very common question. Doctor, you are doing this procedure, is this permanent? What do you answer? You may lose the case. What you will answer? You have to answer something in a very diplomatic way so that you will not lose the case. I tell the patient, is the life permanent? Life is not permanent. How come you are thinking any treatment will be permanent? And then I try to blame them. Who made this problem? Who created this problem? You only created this problem. It's not me who created this problem. Okay. See, we have to, that's what I was telling. In our practice, 50% is counseling only. 24 hours, you are going to the bathroom, you are going to the toilet, every time you are sleeping, every time you are thinking how I will answer these questions at patient's level. Okay. Otherwise, what if you answer at their level, then they will answer, oh doctor, you are taking perfect. Okay. So how much exercise you are doing, how you spend, just to rewind your life video, how you spend last 30 years. Now you cannot, you already damaged yourself. I can't help you. Okay, today you are suffering, tomorrow I will suffer. That's why I am trying to take care of myself. I can only give a temporary, everything is temporary. Life is temporary or treatment is temporary, RF also temporary. Don't give too much expectation to the patient, it will give 3 years, no, 3 months. Let it be 3 years. But you tell 3 months, patient will refer you patients. Because, got it? Because doctor, you have given injection, you have given a transdermal epidural, I am happy for 3 years. Is it possible? No. How patient is 3 years comfortable? Because he changed his lifestyle. So that's why he is thinking, I have given injection, that's why he is getting relief. No. He changed his lifestyle as per your advice, so that's why your intervention worked. Otherwise, so then he will send the patient. So for trigeminal also, I don't give more than 6 months. This is such a disease, I also cannot help tomorrow if it happens to me. So then patient will realize no. So after 6 months you come for injection. If it is giving 2 years, then he will send you patient. Doctor, you have given a very good job. So after 2 years I am fine. But for RF also, because you don't know how much percentage of the nerve you are burning. You know nothing. So that's why don't give too much expectations to the patients. After if you have given 3 years expectation, after 6 months patient came back, you have to do it free of cost. Got it? Doctor, you told 3 years it will be. 3 months I am getting paid again. For regular trigeminal, 10 days I give them time. If 10 days you are not getting relief, I will do it free of cost again. Maybe that time I was fine, but somehow some problem happened, I will do it. But you cannot give too much expectations, then you will be in trouble. So these are small things will help you in a regular practice. Now procedure related, the side effect or complication can be occurred during or after the procedure, or that could be related to the technique or effects of the injected drug early or late. In that way we can divide whatever most important things, the intravascular injections, the vasovagal reactions. So every patient is major case. Whether it's just a facet joint, sometimes you have already have seen whether injecting facets, you are aspirating, blood is coming, which is very unlikely, but it happens. So that's why don't take anything lightly, Every patient IV is must. IV is must. Even I used to tell buy a 22 gauge cannula. It will be less painful because you are keeping for just 1 or 2 hours. Okay, and it will be very easy to put. Anybody can put anyway. Okay, you don't have to put adult patient 20 gauge. There's no need. Even if you can put a 24 gauge, that's okay, fine. But IV line is most important thing. Okay, so we know all these things, nothing special. So if we see the procedure related, you can imagine so many procedures are there, uncountable, at your cervical level, thoracic level, pelvic level, lumbar level. Each and every procedure has its own way of managing to prevent the complications. It's impossible to each and every, but the most important thing is we have to see we can't see the structures in our target. Whatever we are watching in the fluoro picture, our target is not seen. Okay, what we are watching, that is only the guide. So your anatomy knowledge, your imagination power should know wherever needle is going, what are the structures there. You should know each and everything surrounding. That's why your anatomy revisions is so important for every procedure. Whatever you are doing the procedure, what are the relations, what other structures are there, particularly head first structures. You have to be very thorough in anatomy. Otherwise, if say for example you are thinking for sphenopalatine, okay, if your needle is going posterior, you are going into the pharynx. You have to think needle has to be always anterior. Okay, so each and every procedure you have to learn all these procedures. I will not learn, no. Every day we are all learning at our different way. You cannot compare with others. He is doing so much, I cannot do. No, everybody will do someday. You should be on the road. Yeah, I have to learn. So many complicated procedures I have to learn because I am only doing through needles. I will not do any harm. So you have to master the procedures. Many times all doctors till last 1,000 years people are only trying with medications, physiotherapy, all these conservative methods. Now we are era of intervention, minimally invasive. You have to master yourself. There is no time bound, there is no age limit. Age is just numbers. You have to keep on. Today also learning to be more perfect, to reach more complicated zone. Because sometimes patient is having this problem, but because of my less skill, I cannot reach there. So it is my fault. It is not patient's fault. Patient is not getting somebody here around. So in the even orthopedic will send you, neurologist will send you, because they are not reaching there. You can reach there with your skill. They will never see who are you, whether you are able to service. In service, you can do these things. In that way, you have to increase your skill. So implant related, already my last speaker told different implants can be used. But most important, C-arm. You cannot burn yourself. You have to do C-arm. Many procedures cannot be done under ultrasound. Ultrasound has its limitation for bones. But there is no bone, C-arm has no use there. You have to use ultrasound. Got it? So in that way, both you have to master your ozone generator machines. There also, your aseptic precautions are so important. This procedure you have to do. I'm telling you, last 5 years I'm more into disc, because disc is connected with so much disc nerve supply. If you see, disc is not having any nerve supply inside, but whatever nerves are coming to supply the disc outside, they're all connected with the surrounding structures, and from there disc pain is going through this nerve and causing all this problem surrounding areas. So in that way you have to think like this way, and you have to reach the disc, because nowadays it is a era of regeneration therapy. Most of the cases we are doing only palliative therapy. Facet joint, what you are doing? Palliative. Trigeminal, what you are doing? Palliative. Ganglion impaired, what you are doing? Palliative. Cancer, palliative. Few areas are there where you are only working regenerative. So wherever you are getting chance for regenerative, don't think for palliative. You have to try to, disc is dying. One person is dying for doing biacuplasty. Why? What you are achieving? Person is dying, you are killing him.
Shortening his screen time.
So just pain relief is not the target. Target is to support for regeneration. Okay. So it is risky. Problems are there, but if you increase your skill, you can definitely do it. Nothing happens. Okay. Just giving simple example. My daughter, she's only 20 years old. She was suffering with back pain. Long time. Particularly during this HS studies and all this thing. Now she is doing MBBS. I have given twice PRP to her L5S1 back disc. Yeah, nothing happens. Why I will think she is my daughter? She is a patient. She is a patient. So you have to do it. If it is indicated, you have to do it. But how you will do it, that is up to you. Nothing happens. Radio frequency machine, your temperature, your setup, each and everything. Unless you buy your own machine, you cannot learn the machine. You have to invest. These are all investment. You are only just to avoid the patient will buy, patient will pay for that. That's why you are taking a rent. Why will you take a rent? You invest on that. Once you invest on that machine, you will generate cases. You buy RF machine, from tomorrow you will get cases. You can generate cases. You get a RF patients earlier, then you will think when patient will come, when machine is available, whether patient will afford or not. So once we buy the machine, after my FIPP in 2011, I know nothing about, only theoretical about RF. Immediately I bought RF. Within 2 years, I paid the full this loan. Because once I bought the machine, I learned the machine and automatically I was generating the cases. Okay, so these are the very, very important thing. Laser machines, nowadays, all these things we have to learn. Spinal cord drug delivery system, spinal cord stimulation, everything has its own disadvantages, advantages. So take home message, be transparent to the patient. Most important, because patients know we are not God. They know very well. But if you are transparent, they will forget for everything. They will forgive for everything. They will never think of going to the court. No, never. How you are managing the patients, accordingly they will treat you. Okay, because you should have a balance between your business and service. That is very important. Only doctor profession, people used to think they will do only service. They cannot do business. Everyone will do business, doctor will do only service. But we have to do business. Every day we are doing business. So there will be a balance between your business and service. Automatically business will not be very, very prominent, so that your service will be affected, but patient unnecessarily will blame you. Okay, they know, doctor will charge, okay fine. Patient is not able to give, okay fine. But don't give curse and go. That is most important. Whenever you are leaving my OPD, you should give blessings, so that he will send some more patients. So that's why how many patients you are earning from a patient is not important. How many money you are earning from a patient is not important. How many patients you are earning from a patient is more important for us. Got it? So take utmost care for every case. No major, no minor. Everything is major. Always inject dye under continuous fluoroscopy. Very, very important. No compromise. Use always. That's why you make a separate box in your OT. So these are all syringes has to be lever lock, not single. Because lever lock syringe, you will never lose the drug. Many times you are using simple syringe, injecting, because you are not injecting intravenous. Injection always has to be with a resistance. Okay, so then you lose the drug. That patient bought these 2 ampoules, Canacot is wasted. Now again, who will buy this? You have to buy. So always your 3 ml, 5 ml, 10 ml lever lock syringe, 10 centimeter extension tube. These are all practice you have to do. Every dose is stage dose. You are injecting cervical epidural, lumbar epidural. Don't inject at a time 5 ml, 10 ml. No, 1 ml, 1 ml, 1 ml, 1 ml. Wait, 1 ml. Wait. Wait for 1 minute. It will be very, very safe. Once you have injected, now patient gone into vasovagal, you are in trouble. Okay. So don't compare with your work in respect to the charges. That's what I'm saying. Anyway, God will pay you with the patients what patient couldn't pay. Proper informed consent, most important thing. IV line and monitoring are the most important support to avoid complications, are the part of the game. Okay, but tell them even to death. Sir, doctor, you are going to inject in the spine. What will happen? Nerve injury, paralysis. Don't too much focus, but mention. You have mentioned this. This is very important. Otherwise, what will happen, doctor? You didn't tell anything. And then you have to tell, see, I know all these things. In spite of knowing all these things, still I am taking you in the OT. Don't you think I am more responsible for you?
More risk.
I am trained. I have spent so much time. You should explain the disease first to the patient. When a patient is coming, don't think for the treatment. You first explain it. Do you know what happened to you? Many people, even if educated, they don't know what happened to them. And they will be very, very happy, they will be satisfied to your explanation. Doctor, today I come to know what has happened to me. Last 5 years I didn't know, nobody told me. किसी ने बताया नहीं, some time ही नहीं दिया. So you should have a good models in your OPD so that they know their problems. Automatically they will be more faithful to you. Take whatever you tell, they will accept. Because you know the subject, you could explain them. Last is you keep learning, upgrading your skills, knowledge, which is maximally support to give the better service. Your learning, which should go on. There is no limit. Okay? Thank you.